Colorado is seeing a rise in COVID cases as the Delta variant becomes the most dominant strain in our state. And as kids get ready to head back to school, parents may be wondering how it's affecting kids. So here now is Dr. Reginald Washington, the Chief Medical Officer of the Rocky Mountain Hospital for Children. And Dr. Washington, is the Delta variant more dangerous to children compared to the original strain?
The preliminary data does suggest that not only is the Delta variant more easily transmitted to children and adults than the previous variations of the Delta of the COVID virus. In addition, it does appear to be a little more serious as far as symptoms are concerned. We're seeing a slight increase throughout the country of children who have the new variant being admitted to the hospital.
Okay, and I know only children 12 and older are eligible for the vaccine. What's your advice to parents of children who are too young to get the shot? What should they be thinking about?
Well, I think parents have an obligation to try to protect their children from getting COVID. And the easiest way for them to do that is to have their children wash their hands frequently, socially distance when possible, and wear a mask whenever they're in crowded conditions, including schools.
Okay, and the fall is usually a time when we see an increase in other illnesses like colds. What are the symptoms that parents should look out for to know that their children's illness is more than just a cold, maybe COVID?
Well, first of all, I think if your child is sick, you should keep them home. You should not send them to school where they risk passing on whatever they have to their classmates as well as the adults in the building. Unfortunately, the symptoms of COVID in children resemble very much the symptoms of a flu-like illness: fever, chills, respiratory issues, headaches, and some GI symptoms. So it's going to be very difficult for a parent to look at a child and say you do or do not have COVID. So if your child is running a fever more than a day or two, or their symptoms progress, we would strongly encourage them to seek medical advice and let that clinician decide if they need a COVID test or some other measure, because there is an overlap of symptoms.
Right, and I know a lot of parents with kids going back to school, some districts have mask mandates, some don't. What's your advice for parents who are sending their kids back into that indoor environment?
My personal feeling, and the feeling of the American Academy of Pediatrics and others, is that the most effective way to protect children from getting COVID is to wear a mask in school. Now, various school districts have different opinions about that, but my personal opinion, and again, the opinion of the American Academy of Pediatrics, is that children wear a mask while in school, if over the age of 2.
Okay, and is there anything else that we haven't talked about that you think is important dealing with kids and COVID for parents?
I think the most important thing is if your child is sick, you need to seek medical advice to determine if it's COVID or something else. We're already seeing an increase of RSV infections, which is a viral respiratory infection. We're already seeing increased amounts of that in the community. So we expect we're going to see a mixture of COVID and RSV during the fall and winter months.
And I'm sure testing just to make sure it's COVID or not is really important during this time. Thank you so much, Dr. Washington, for all this important information. We really appreciate it.
All right, thank you, and have a nice day.
Thanks, you as well. And for more information on mask mandates at your school district, you can head over to cbsdenver.com.